A very good morning to all. Today, I'm Dr. Reena Sethi, Director, Arunodaya Deseret Eye Hospital in Gurgaon, Sector 55, Gurgaon. This is a purely eye hospital, and then I'll be talking to you about how to protect and take care of your eyesight. Glaucoma is also called kalamotia, which causes damage to the optic nerve. The pressures in the eye are such that they start damaging the optic nerve. They are high, and this is what happens. The images that you see here, like here, this is a normal vision, but then the early glaucoma, the peripheral vision starts getting hampered, and slowly as the glaucoma progresses, you start only seeing at the center, but you just cannot see anything that is at the periphery. So the risk factors are usually when you're over 60, and I would suggest that every patient over 40 must have their pressures checked, and especially if there are medical conditions like diabetes, heart disease, high blood pressure, you must have your intraocular pressures checked. If you have a family history of glaucoma, you have a high incidence of also getting glaucoma. If your parents, grandparents have had glaucoma, do not take it lightly. You must have at least one visual field done so that you know that your functioning of the nerve is all right. And if a diagnosis is made, it is an early stage and treated appropriately, vision loss can be slowed or preventive as well. So early diagnosis is the crux of this treatment and prevention of further deterioration of vision in glaucoma. So during a proper diagnosis is dependent on a lot of investigations in glaucoma, because not only pressure which is checked by different methods. This is the tonometry, the applanation method. The pressures are checked. You need to do gonioscopy, where you need to inspect the angles of the eye, and also you need to do the field testing, like in here. The field testing is important because this is a method in which the patient sits in front of the field analyzer, and you check the functioning of the nerve, and also you need to do some scans of the nerve if these few tests there is a problem, and the doctor suspects that there is a problem in the eye where glaucoma is concerned. And the treatment is lowering of your eye pressure, that is the intraocular pressure. There are a lot of options in eye drops available, which are tailored for the patient. And also these eye drops, they decrease your eye pressure by improving the flow and the production of the fluid in the eye, which is called the aqueous humor. And depending on the condition the severity of your glaucoma, the lowering of the eye pressure needs to be done. The other treatment modalities are laser therapy, which is the laser trabeculoplasty, which is an option. Small laser beam is, focused onto the angle so that the blocked or clogged channels are opened. The filtering surgery is the important kind of a procedure, is a frequently done procedure if the eye drops are not helping. This is a procedure where you make an opening in the white part of the eye, that is the sclera, and that gives you a connection onto the, again, the trabecular part, that is the drainage system of the eye. And sometimes you need to put some drainage tubes if this is also not helping, or you can also do a minimally invasive glaucoma surgery, which is the latest now, in which you post-op care and the less risk of, the other risk of having an open eye, and it's an important procedure, but it's only for patients where we need to drop the eye pressure by a little bit and titrate the eye pressures. Thank you very much all. Thank you.